Why is a biopsy taken during GERD endoscopy? Imagine going for a routine checkup and discovering something unexpected inside your esophagus or stomach. That's where a biopsy during a GERD endoscopy comes into play. When doctors perform an endoscopy for acid reflux and gastroesophageal reflux disease, they use a thin, flexible tube with a tiny camera to look inside your digestive tract. This helps them spot any visible signs of damage or abnormal tissue. But sometimes, what they see isn't enough to tell the full story. That's when they might take a small tissue sample, called a biopsy. A biopsy allows the doctor to examine the tissue under a microscope. Even if your esophagus looks normal during the procedure, the biopsy can reveal hidden issues. For example, it can show if there's inflammation or irritation caused by stomach acid that isn't visible to the naked. This is important because ongoing damage can lead to more serious problems over time. One key reason for taking a biopsy is to check for Barrett's esophagus. This condition happens when the cells lining the lower part of your esophagus change due to long-term acid exposure. These cell changes can increase the risk of esophageal cancer. Detecting Barrett's early helps doctors plan better treatment and monitor your health more closely. Biopsies are also used to rule out other conditions that might cause similar symptoms. These include infections, such as those caused by bacteria called Helicobacter pylori, which can lead to stomach ulcers and gastritis. Sometimes, biopsies help identify celiac disease or other types of inflammation that could be contributing to your symptoms. Not every person with acid reflux needs a biopsy. Doctors usually decide to take one if your symptoms don't improve with treatment, if there are signs of complications, or if they want to check for specific tissue changes. The process of taking a biopsy is quick and safe. It involves removing a tiny piece of tissue with a special instrument passed through the endoscope. The sample is then sent to a lab for analysis, which can take a few days. In the end, a biopsy during a GERD endoscopy gives your doctor a clearer picture of what's happening inside your esophagus and stomach. It helps identify hidden damage, rule out other conditions, and guide your treatment plan. This way, you get the best chance to manage your symptoms and prevent future health issues.